This episode of The Profit Express is brought to you by Corbett Public Relations, promoting and protecting businesses and brands for over 30 years. So please visit my good friends at CorbettPR.com. That's CorbettPR.com. CorbettPR.com. Well, hello and welcome to the Profit Express. I am Tim Healy, and I'm inviting you to join me each and every week so together we can win the battle for business. And don't forget to listen and download to new episodes every Wednesday when they drop. You can follow me and the show on Instagram at The Profit Express. You can follow me also on Facebook at The Profit Express page and also on Twitter at Profit_Express. So thanks so much for spending some time with me today. Now, today is going to be, I think, a unique show, a special show, because it's going to be relevant for you, the business owner, the CEO, and also the individual. Because today I want to talk about the industry itself is healthcare, which is a vast industry. However, and more specifically, I really want to talk about what it is to be a physician owning, running, operating your own primary care practice. What is it like to be a pediatrician running your own pediatric practice in 2021? Now think about it. Most of us are going to need medical attention and care at one point or another. And most of that care and attention really comes at your doctor's office. Hopefully you don't have to visit the hospital too often or the emergency room. Now ask yourself, over the last 5 or 10 years, how has the service at your primary physician's office changed? Has it gotten better? Has it gotten worse? What about the pediatrician's office for your children? Has that care gotten better or has it gotten worse? And the reason I think that this topic is so interesting is because there are few industries who have seen so many changes, so many challenges in recent years. Healthcare has faced challenges from insurance and technology and regulations. And now you look at it from the perspective of service. How does that impact the service on you, the individual, the patient? Then also, we have to look at it and have a discussion from the physician side. How are they making a living? And listen, this is the Profit Express. It's okay to make a profit. We want to make a profit. And then how do we encourage and incentivize our next generation of physicians to be able to come in and make the sacrifices necessary to enter into the profession? A profession, I think, from my perspective, is getting more and more challenging as time goes on. So in order to tackle a topic like this, I have thought of the show for a while, to be honest. And, obviously I know physicians. I have my own primary care physician, of course. My family has our own physician. But I came across today's guest. I was introduced to today's guest, and she has a very unique background that I think suits her quite well to discuss today's topic with us. And she's Dr. Kerry Fierstein. And she has 30 years as a practicing pediatrician. Okay, so she's been a pediatrician for 3 decades. But she's also, which makes it a very interesting conversation for today on the Profit Express, she's a CEO of Allied Physicians Group and the CEO of Adjuvant.Health. And her mission, her passion and purpose is to advocate for physician-owned pediatric practices. So there's a lot of very interesting angles we're going to take today, a lot for you to learn and absorb as the business owner, as the CEO, and of course, the interesting side as the patient, which we all are. So it's a pleasure to welcome aboard the Profit Express, Dr. Kerry Fierstein. How are you today?
I'm good, Tim. Thank you for having me.
No, my pleasure. And as I said, this was a topic that's interested me for a number of years, from 2 perspectives. A, I'm a patient like every other human being. I'm a business owner, and I've seen a lot of changes, a lot of regulations, technology, insurance, et cetera, that's put a real squeeze on what it is to be a physician, a primary care physician, in your case, a pediatrician. And you have a unique background, not just as a medical practitioner, but as a CEO. So I'm very excited to have you here today. Looking forward to the conversation.
Thank you.
So before I get into some, the conversation itself, again, you are a CEO of two companies. So give us a little bit of a background as to those companies and your role in in those companies.
So I've been in practice, like you said, 3 decades, which seems like way longer than it should be, or certainly longer than it feels. But I did become a grandmother this year, so I guess
Congratulations.
I've earned that title.
Yeah.
So I was in private practice with my partners. We started in 2001 and we grew, very nicely. We were very successful. And around, 2011, 2012, we realized that we needed to align ourselves with a larger group because it was just getting very difficult to deal with the insurance companies and the regulations and all the things that you have to do when you're running a business, let alone a medical business.
Right.
And we knew we didn't want to sell to a hospital, which was happening a lot back then. It's still happening now, but it's definitely slowed down a little bit.
Sure.
And pediatricians tend to get lost in a multi-specialty group because pediatricians are maybe a little too nice and we don't generate much money for the organization. So, we tend to get pushed a little bit to the side.
Really? I never considered that aspect, being a pediatrician.
Yeah, there's not a lot of money in pediatrics. So when you join a larger group, it tends to be the people who bring in the dollars who get to talk.
Yeah, okay.
Everybody talks about the children, the politicians talk about the children, but when it comes to actually, putting up any money to the children, it doesn't always happen.
Got it.
We were lucky that Allied Physicians Group was in our neighborhood. And that's a pediatric practice without walls, which means it's individual practitioners that come together. You have to do certain things for antitrust. So we had to go under one tax ID, share health insurance, share retirement plans, things like that. And then we can negotiate with insurance companies collectively, and we can do other things collectively, buy vaccines, negotiate for Cablevision, whatever else that is that we do. So we decided to join that in 2011, 12, and that's physician owned and physician led. So
and that's the big difference, right? The fact that it's physician owned.
Yeah, that's a huge difference.
Okay, I know we're going to get into that, but I just want to highlight that for a moment. Okay, go ahead. I'm sorry.
So because we had the ability to be involved in what was going on, I got involved at every level because I wanted to make sure that I was able to influence the direction that the organization went. So I went to all the committees, and we tend to be run by committee, and any doctor, any partner can join a committee and help influence the direction that we go. But once we make a decision, then everybody goes along with that decision.
Right.
And at that point, we've already had buy-in, so, it's good. So I got involved in all the committees, and then I became the treasurer, and then I became the chief medical officer, and then I became the chief executive officer.
Wow. So you really, from the ground up, had quite a diverse experience in the organization.
Yeah, so I knew, all the facets of it, all the people, and it worked out nicely for me.
Now, so did you think, when you first decided to go to medical school, okay, so you're thinking I'm going to become a doctor, I'm going to become a pediatrician, was there much consideration or any thought? Again, it's 30 years ago. A lot changes in a lot of industries in 30 years. Were doctors thinking about the business side of things, when you started out?
Well, I knew I would go into private practice, and private practice is a small business.
Right.
I really thought it would be much smaller than the business that I'm in now.
Right.
But I thought way back then about opening up a daycare center next to my pediatric practice and somehow doing sick and well. And I never followed through with that. But I always had a business.
Yeah, you have an entrepreneurial mindset, it seems like, for sure. Okay. All right.
And so Allied Physicians Group we hired people to help us manage because doctors all of our doctors are seeing patients and seeing patients most of the time. I'm probably the one at this point now as CEO that's seeing them less of the time, but most of our partners and our doctors and our committee chairs are all primarily clinicians.
Right.
So we have executives, MBAs, you know, CFOs, people that can help us do the business aspect of it. So at some point about 3 years ago, we decided to spin off that arm of our business into a separate management service organization. And that became Adjuvant.Health. So Adjuvant had its own CEO. And then in the last year, there was an opening, and I questioned whether I was really able to take over that role as well. Because it's one thing to run a bunch of doctors. I kind of am familiar with them. I know that, but the corporate end of it is different, and as we've spoken over the years with the corporate people, they were always, well, who is she reporting to? And, what's the structure? And that's not really how doctors think. We think, how do you make something happen? Who's the best person to do it? And, not who owns the project and who reports to who. But there were really great people, and I had been there long enough, and I decided to challenge myself and challenge the organization and move forward with it, and it's worked well.
And all right, so then you became the CEO of Adjuvant last year in 2020?
July 20. Yeah.
Wow. Okay. So obviously, I don't have to tell a doctor what happened in 2020 with the pandemic. So you essentially have two careers. You're a CEO and you're a practicing pediatrician. And as I said earlier in the intro, you're an advocate for physician-owned pediatric practices, and that's a key in part of our discussion today. What I'd like to ask you now is, now that you have three decades, how has the operations of a typical medical practice, pediatric practice changed? What have been the big, I'll call it sea changes in that time that you've noticed?
Biggest change was insurance.
Yeah.
So when I first started, we really didn't take any insurance. Patients would pay us. We would give them a bill. They would submit it to their insurance company. They would get paid back at whatever rate they got paid back. And we didn't have to really worry about that.
Right.
And, our practice, this was before I opened my own, was probably one of the later ones to switch over. But that was probably in the 80s that all of a sudden we now become the collection agency for the insurance company.
Right.
Right? Your contract is with the insurance company. We provide a service, and then somehow we have to then collect that. And then the patient, gets upset at us when the bill, the insurance company didn't pay for something, or the bill is too high, and they expect us to tell them when something is or isn't covered.
Right.
When, especially as a pediatrician, we're on 30, 40 different plans because we want to be as accessible as possible. And each of those plans is different. And even within a given plan like Blue Cross, there are probably, 10 or 20 different types of Blue Cross. So just telling us you have Blue Cross doesn't even help me know necessarily what's covered or what's not.
So it's almost, overnight, or there's that change where all of a sudden, okay, now we have to have a billing department. And like you said, the contract is with the individual insurance company, but you guys are doing all the back office work.
Yes, isn't that lovely?
Yeah, I'm glad I'm not in the business. Sorry. All right, so insurance is the first big change. What else has really made a significant change for how primary care, how pediatricians practice medicine?
I would say electronic medical records has been a sea change, because all of a sudden you're carrying your computer, with you everywhere. It's great in many ways. We have access to things. Things are easier to find. We used to lose charts every once in a while. Not for a long time, but there used to be the employee who was able to figure out how we misfiled something,
Okay.
like
Yeah.
by the last name, by the middle name, looking for things. So we don't lose charts anymore, which is great.
A great aspect of technology, right?
Yes. But there's a lot more clicking and things to fill out and latency times that makes it harder to put in what's key for the patient and not a lot of other stuff. And I think that also the EMRs were built, and people will tell you this, they were built as billing and collection venues. So
Right.
they were really set up for us to tell the insurance company what we're charging them, not actually to take really good care of the patients. So we've tried to massage them and manipulate them to do what we need them to do. And that's one of the great things about being a physician-owned practice is that we actually put a lot of energy into our EMR and making it physician-friendly. But that's certainly an issue. And then the other issue is that you can always take your work home with you now. And we never used to be able to take home the chart because that was important to stay in the office. But now you always have your work with you. So there's that expectation of always being available, not even just by the patient necessarily, but by your coworkers and vacation isn't vacation anymore. Like everybody, right? All small business owners have their phones with them and they're being, texted and called, but this is really on a whole other level.
So, I mean, listen, as an entrepreneur myself, I always try to make myself as available to my clients as I can, but the level of my service and what I provide versus the service that a physician, a pediatrician like yourself provides is vastly different. You could certainly say there's no other more personal service than medical care, of course. So insurance was a big change. The EMR. Go ahead.
And then the next one I was going to say is HIPAA. So the government.
Oh, yeah.
Now everything is HIPAA. It's gotten insane to the point where, we've had to put screens on our EMR, on our computer screens, like, privacy screens, because what if one of the patients happens to, crane their neck over their shoulder and they shouldn't be able to see somebody else's data? We send somebody to train on the EMR for days, but somehow a patient walking by is going to be able to glean everything they need in a glimpse kind of thing. We have patients who make, in pediatrics, we have patients who make play dates in the waiting room. This was before COVID. But we're not allowed to call them by their name, crazy things like that.
So that it's, we get into our professions, okay, whether it's law, accounting, medicine, for, one would assume, a love of medicine, a love of helping, a love of healing. And like any profession, there's the drudgery to it. It's just part of life and business. Has the insurance world and the EMRs, the technology, the HIPAA, has it made it less fun for you to be a pediatrician? Less enjoyable? I don't want to say fun in a light sense, but enjoyable, I should say.
No, not for me. I still enjoy every day going in, being with the kids, helping the parents, doing good things. Like occasionally I'll see a patient and I'll walk out and go, wow, I've changed that child's life. I don't know that the parent knows that, but we did together today. And
right.
And that's kind of cool. And then obviously there are, times when the parents are grateful, and I didn't do that much, but whatever I did was really helpful for them. But part of that is being independent, being an owner, getting to make a lot of my own decisions and not feeling like I'm being dictated to every aspect of my day.
All right. So that's interesting. So as a business owner, as a patient, that catches my attention. So there's a lot of, like, as you We're here on Long Island. People listening to Private Express all over the country. The world, hopefully. And on Long Island, there's been a number of hospitals that have acquired the majority, or I don't know the exact statistics, but quite a few practices, as you said, that happened probably around 2012. A lot of that started, maybe 2010 or so. So how much you have and I want to make sure the listener gets the distinction. Physician owned versus whether it's hospital, whether it's corporate owned. I know there's outfits out there that are owned in part with companies that have ties to insurance companies. And that in itself seems like an interesting relationship. I mean, that itself could be a whole conversation, but I'm not an expert enough to talk about that. Talk about, because a physician has to make decisions for the best care of their patient. How much has it changed since when you started to today? And I know you're in a different environment as far as like maybe you hear with your other colleagues or peers outside of your company, as far as how they're being dictated to, how that impacts their real ability to do what they think is ultimately right.
I mean, it's hard for me to say what other people are doing or how other people feel. I do know that, when you're in an organization, there are incentives and pressures to keep any referrals within that organization. So,
Right.
One of the things with Allied that our clinicians love is we can choose the best referrals from local hospitals, or private practice. We're not forced or we don't feel any pressure to send a patient to any given practitioner. So that's huge. I mean, when we go into the room with our patient, it's us and the patient and nobody else.
So then you don't have the sense of these mandates of, okay, choose from a predetermined list of people you can refer your patients to. It's always, if I'm getting you right, it's always, at the end of the day, who do I feel is the best solution to recommend, to my patient?
Absolutely.
Okay.
Yeah, I mean, we do have parameters, not necessarily with referrals, but, there are things, HEDIS measures that the insurance companies want you to meet.
Mm-hmm.
In an adult, it would be, did you get your colonoscopy? Did you get your mammogram?
Mm-hmm.
In pediatrics, it might be, did you get this developmental screening? Did you get your lead test? Things like that. So we do have to fit into the world and deal with the system as it is, but not all of that is necessarily bad, and we're able to interpret it as we want to. So, one of the things that Ally did was we created a matrix, and that's to figure out how to incentivize our physicians to do the things that we want them to do. So we decided early on that we're not going to just say, okay, the insurance company gives you money for this, so we're going to tell you to do this. We're going to look at it and say, okay, what makes sense to do for the patient? So Allied had the postpartum depression screen on our matrix, before it became a New York State mandate, because we knew from taking care of new moms and dads that this is something that's important to follow up. And
Sure.
You couldn't leave it to the obstetrician who doesn't see the mom until 6 weeks. And, even if they do it, we do it, it becomes something that, we work together as a team. So that's something that we put in our matrix. And
So it's a self-designed matrix.
Exactly.
Okay. So you're not waiting for the state. You're not waiting for other industry norms. It's like, what do we feel as physicians, as pediatricians, that's in the best interest of our patients?
Exactly. And we take into account, like I said, some of the requirements of the insurance companies, but we're picking the measures that make sense to us, and we're implementing them in ways that make sense to us.
Now, this is something interesting. I'd be interested to get your take on it. There is the fee-based service model, and correct me if I'm wrong, and it seems to be evolving or migrating to risk-based contracts. So maybe can you explain the difference, and what is one better than the other? What is one? Which one would be better? Again, if we always look at the bottom line in your world, patient care. So how does it incentivize, and how does it impact the ultimate service that patients are getting?
So we've stayed away from risk-based contracts.
Okay.
Because we can't control our patients' behaviors. And a risk-based contract says, I'm going to take responsibility for Johnny and every service that he has. So if mom decides to take him to the dermatologist or goes to the urgent care, it adds up, and at the end, we get penalized. So until we're able to, have a better control over the patients, like, it's not to put the doctors in charge of care but give them no authority over that care and
right
risk. I'm not an insurance company, right? I'm not getting those premiums of an insurance company. So we'll take some upside risk, meaning if quality measures are met and a certain amount of money is spent or isn't spent, we might see some upside from that, but we're not willing to take risk on something when we have no control.
So again, so the risk-based contract, an invention of health insurance companies, I assume?
I guess. I think the government also feels that somehow if you incentivize physicians properly, that they'll take better care of their patients. In pediatrics, that's not the case. The issue is we take really good care of our patients, but the insurance company doesn't see the benefit of that for 20 years. So they're not willing, right? When that kid doesn't start smoking, when their weight is okay, when their asthma, they might see a little bit sooner. When we deal with the anxiety of an 8-year-old so that, they're not taking medications or being hospitalized when they're older, by that time, they probably changed to a different insurance company. So, that's the problem in pediatrics, that what we do doesn't have an immediate effect.
Well, you did a great job of kind of creating a visual of that. I think it's almost unrealistic as you're describing it, and I'm glad I brought this one up because I was curious about it. The risk-based contract is almost unrealistic, because I'll just talk of myself. I'm probably a horrible patient. I know my own physician has given me plenty of tests. I won't get into details of things that I've blown off for years, and I'm not kidding you. So then how is it possibly fair for my own physician or any other physician to then be compensated based on the fact that there's good patients and then there's not good patients? And what are we doing, that you have absolutely no control over? So that's an interesting analogy there.
And fee-for-service has its issues also, because there's sometimes we want to give the right care in the right place at the right time.
Right.
And yet we only get compensated for certain types of care. Before COVID, telemedicine was often not paid for. And I don't use the word reimbursed, I use the word paid, because we need to be paid for our services.
Absolutely.
When you go to the supermarket, you're not reimbursing them, for dinner. You're paying them, right? So
absolutely,
we need to be paid for what we do. And the insurance companies were not paying for telemed a lot. So you would have to bring a patient in to do a service that you perhaps could have handled in a different way. And how does that make sense for anybody?
So before COVID, because obviously COVID was a game changer for everybody, so many industries. Before that, you were not being paid or reimbursed as a viable option, televisits?
For some insurance companies we were, for some we weren't. And again, then we have to keep track of that for a patient. Is this going to be covered or not? Because that's an important question for a patient.
Absolutely. Because based on that, a lot of individuals decide whether or not they're going to get certain care if they have to go out of pocket, impacting their own possible outcomes. So
No,
You,
and
you
then there are things that perhaps we could handle, through a phone call, but it's not a 2-minute phone call, it's a 15-minute phone call.
right.
And we don't get paid for phone calls. So that used to be part of doing business, and to some extent it still is, especially in pediatrics.
Right.
But as the insurance companies squeeze things tighter and tighter and you have less margin, it just becomes a lot harder to give away services or to spend an hour or two after your day than talking to patients. So fee for service becomes an issue there because we're giving a service, but that's not a service that's paid for.
So it's almost as if, and this is where I can really develop some empathy for physicians, for pediatricians, where it's like a typical business owner sells a product or a service. Okay, they create a price for the product or service, and the market basically determines whether they're going to pay it or not, and you're competitive or you're not. Okay, and you buy the product or service. But do physicians, I'm not saying you in general, you specifically, but in general, when a physician does the work of practicing medicine, it seems like they are under a lot of pressure, and perhaps they are, and I'm forming the question as I'm speaking right here, obviously, but they really just can't do what they want to do in a lot of situations. I don't make a lot of general statements, but it just seems like the practice of medicine and doing what you think is best is compromised because of everything that we've been talking about, whether it's insurance, whether it's HIPAA, whether it's technology. Is that safe to say? Is that accurate?
It was definitely a lot simpler in years past.
Is it a crazy thought to think that we could ever go back to like when my parents, when you would just pay X dollars and then insurance wasn't involved? Is that a crazy, fanciful thought?
Well, there is an entire movement in this country called DPC, direct primary care. And that's where you pay the doctor a certain amount a month, $75 a month, $100 a month. And then you get whatever services you need. If you need to come in, you come in. If you need a phone call, you get a phone call. If you need a telemed, you get a telemed.
It's like a concierge kind of service?
It's not really concierge, because concierge, you're paying, large sums of money, $1,000, $2,000, and oftentimes they're billing insurance as well. DPC is on a much smaller level, and the physicians actually try and keep costs down tremendously. So, they don't have, think about if you don't need a billing department, right? So there's a lot more access to your physician, and you're paying for the stuff that you need, or you're just paying and you get what you need, basically.
So it seems like it's potentially allowing you to run your practice a lot more efficiently with a lot less overhead, potentially.
Yeah, the doctors who do it feel so much more connected to why they went to medical school.
Really?
Just right now, it's nothing that a group like Allied could do, because there are patients, people are paying a lot of money for their insurance.
Sure.
Then to turn around and pay on top of it. And then there's vaccines, and vaccines are a huge expense for parents if they would have to pay for them, for pediatricians. So, it's not a model that works for everyone, but there are places in this country where it's definitely taking off. And certainly for people who can't afford insurance, instead of having to go to an emergency room or go to an urgent care, we know that they get much better care when they have a primary care doctor.
So now, again, today's guest, Dr. Kerry Fierstein, and I've wanted to talk about this topic for a while. The topic of certainly not just healthcare, but what it is to run a medical practice as a primary care physician, as a pediatrician, as is in your case, and all of the changes, the regulations, technology, insurance, and how difficult it can be for you folks. So you are a practicing pediatrician, and you're also CEO of 2 companies. And we're also coming off of a pandemic year. We're still in the pandemic, but certainly no other industry was hit like the medical industry was hit. And I've interviewed a lot of business owners. We often think of restaurants as an industry that got really hurt. because of the pandemic. So now here you are, you're not just a practicing physician, you're also a CEO. It is March of 2020 and COVID-19 hits. You oversee, I believe it's about 150 medical practitioners. You have about 500 employees. Is that right? Okay. Those are significant numbers for any CEO. But you're not just manufacturing widgets, you're medical practitioners. So take us back to that point. What did you first, I'd be interested to hear what you first did as a leader when the pandemic hit.
So the pandemic didn't just hit, right? It's not like one day, it feels kind of like one day it wasn't there and one day it was there.
Right.
But, we got information in drips and drabs.
Right.
Initially, we didn't know that children weren't going to be heavily hit, right? Thank God that it, because we looked back at H1N1, and when that hit, if you remember the swine flu or
Swine flu, yeah.
H1N1, kids were the only ones that were hit, and our offices were overrun. We had patients waiting out the doors. I had, one patient say they thought it was the zombie apocalypse when they got into my office. And we didn't know that wasn't going to happen. So we didn't know whether we were going to have to rev up. I mean, that's what we were planning for.
Sure.
And then what happened is everything just stopped. So nobody came into our offices at all. We lost sick care, we lost well care, because unless it was vital, you had a newborn or something, you really weren't coming in at all.
Right.
And, so that was a business issue, because now we need to look at what our costs are.
Sure.
And how to make it through. But that's also a public health issue, because you can't stop doing well care on children. You can't stop vaccinating children. We had a measles outbreak in New York City, 2 years ago? So if you stop giving vaccines, then you're going to have not only COVID, but you're going to have pertussis and measles and, all the other things that you need to worry about. So we had to kind of look at it, from a few different fronts. So, from a business front, it made me realize that we really do have a very good model. So in our model for Allied, each division has a partner, at least one, sometimes more, and that partner really knows the ins and outs of their business. They're actually, a little profit center. So they looked towards Allied, towards Adjuvant, actually, towards our home office staff, and we call it our home office, right? Not corporate, because, we have our pediatric.
I like that, yeah.
And we have our home office.
Right.
So they look towards our home office staff to say, what do we need to do? And we have a tremendous amount of data, so we were able to do analytics and finances, and, we gave people targets. You need to cut expenses by X. Whether that's talking to your landlord, cutting your hours, and most people cut hours because, my office was open 8 a.m. to 7 p.m. before COVID. We were open, 8 to 2 on Saturdays, and you just didn't need that because everybody was home. So you don't come in after school when there is no school.
Right.
So we gave our divisions, our offices, these parameters, and allowed them to, kind of come up with, well, what's the best way to do it for them? And then we ran it through HR to make sure that it's all compliant. Because while we're individual offices, we're all one company. So we can't discriminate. We can't do things very differently in one place, than another.
Sure.
So our HR department was really working overtime as we figured out, who should be furloughed and how we were going to handle all of those things.
So it sounds like in the model that you had, it allowed for some peace of mind for the physicians because this pandemic hits, nobody knows what's going on initially. Okay, the dust has to kind of settle. Nobody's out of their house. And then, it's still a business at the end of the day. There's still, the cost, the insurance, the rent, the electricity, so on and so forth. But your model allowed the physicians the back end support to still kind of be autonomous as an owner, but then have kind of that the support that's needed, as a business owner in a crisis, and that's what it was.
Yeah, and then they also needed clinical support because things were changing every day.
Yeah.
So, what is safe to do in your office? So we as a leadership team, our CMO, our CQO, which is our quality officer, and really all of our board, which are all physicians, we were meeting every day during, the month of April to see, well, what's allowed in New York, what's not allowed, what is the science telling us, how do we get PPE, all these things. And by doing that centrally, every doctor in their office didn't have to be doing all these things. I couldn't possibly imagine having to keep up with all of the clinical things that were coming out at that time, at the same time trying to change protocols in my office and run the business of medicine. And then also do outreach to our patients, because our patients were craving information. And it was an interesting time because we didn't have all the answers. And that's an unusual position to be in as the physician, right? Because most of these diseases that we're dealing with, we have, a tremendous amount of information. And I could tell you, well, this is the epidemiology and this is how long and this is what you need to do. And with COVID, we just didn't have those answers. But we gave our patients the information we had, as we had it, saying, well, this might change tomorrow.
Right. But, well, yeah, of course.
Right?
So, but it sounds like it also made it a lot easier for your physicians to just practice medicine.
And that really is our model, that most physicians don't want to deal with hiring and firing and IT and HIPAA and all of those things. So we do that so that the physicians can concentrate on practicing medicine.
Right.
And if a physician has an interest in something, then they can be part of that committee. They can join, those efforts, and they can absolutely influence what happens, in all of Allied, which is great because you're not only contributing to your small corner of the world, but an even bigger part of the world.
Collectively, right. So now you've got the medical practitioners, 150, you have 500 employees in various roles, of course. COVID for the world, for America, for New York, had a big toll mentally, physically, emotionally, financially. I don't have to tell you, obviously, on a lot of people. Once we start to get into it, and now we'll fast forward it, Kerry. Now it's April, May, June, and you guys are in the thick of it as physicians, okay? Physicians, nurses, staff are human beings too. They're dealing with this pandemic. Actually, I think, what I do for a living compared to what you guys do for a living is a joke in a situation like this. It really is. How do you, as the leader, how do you as a CEO help your people, the physicians, the staff, deal with these anxieties in something that nobody's experienced before? I mean, that's a tall order. What was your approach?
We did a lot of communication.
Mm-hmm.
So one of it was the medical side, give people the most up-to-date medical information.
Okay.
And we decided to funnel all communications for that through our CMO. So, if somebody had something that they found out that they thought everybody would want to know, for the first week or two, people were sending various things out and it was just too much information. So,
right.
And then you don't know whose emails to read and whose emails not to read. So we made everything come through our CMO from a medical standpoint. And anybody that had any information, whether it was about COVID itself or how it affects children or testing, that became a big issue. How do you test? And that was one of the things that we were able to do, as a larger group, is to get testing supplies to our doctors, which was definitely a good thing for our patients and clinically, and also good for business. But so, the clinically thing, we ran all the communications through our CMO. We do have a culture program, and we have some coaches that we've worked with in the past.
Mm-hmm.
And we had some, meetings for our physicians and for the practice at large, just to talk about the fact that there is stress and that people don't always know the right answers. So we did that. We work with National EAP, so that was always available to our employees, and we
Right.
made sure that they knew about that. There was a weekly meditation that NEAP did that I joined once or twice, which was really very enjoyable and nice. So we tried to have those avenues around. And then a lot of it was just done, one-on-one in the offices. These are the people who work together and know each other. They're the ones that can support each other.
Right.
And a lot of it was just, feeling safe. So we switched, unlike a lot of medical practices, we were actually doing telemedicine for at least 2 years before COVID hit.
So you were comfortable with the model before the pandemic?
Yes, but
Okay.
we had to expand it dramatically.
Sure.
So we expanded telemedicine dramatically. So we were able to see our patients and not necessarily bring them into the office when we didn't know whether it was safe or not. So our employees felt that they weren't being exposed unnecessarily.
Do you think that, because actually my son did go to one telehealth visit, my wife facilitated, obviously. How is it from, as a tool? How effective is it? I mean, obviously we had to use it for COVID, years from now. How effective can it be as an option in medical practices?
It definitely has a place.
Okay.
A 2-year-old with a fever still probably needs to be seen, although maybe not on day one, right? You could give them a chance to see what develops over the next day or two, but yet you can give the parent that reassurance by seeing them. Most rashes, we can look at conjunctivitis, and then the mental health issues. That was huge, and telehealth has been a huge help with that.
So, as I'll ask it as a 2-part question, as a pediatrician and then as a CEO. So, we're still in the pandemic. I'm thinking we're past the worst part of it. At least I'm hoping. Maybe I'm wrong. You tell me. What was the single greatest lesson you learned through this pandemic as a pediatrician and as the CEO?
I mean, there are so many lessons that we learned during COVID.
Mm-hmm.
I think staying calm is always a good thing to do. And as a pediatrician and as a parent, that's always been my superpower is being calm. And I think when you're a leader, you have to do that. That doesn't mean that you're not realistic about things, but if you're calm, you can figure a way forward. And that was really important. And then being with the right people and listening. So the questions were, as a CEO, one of the things that I've learned is I don't need to have all the answers. Sometimes I feel like I don't have any of the answers, but I can ask the questions and facilitate the conversations. And early on, it was identified that mental health and anxiety was going to be an issue. And we started to run these webinars for our patients. And, we've done webinars directly on anxiety, but we've also we did our first webinar, I think, was on COVID. And we combined with pediatricians in 3 other states, and we had over 1,000 people on it because parents were so hungry for information. do I go to camp? Do I go to school? Can I visit grandma? What are the things that I can do and that I can't? And, that came from just having conversations about, what do we need? How do we get in touch with our patients? And it turns out that it's an amazing, almost zero cost way to communicate, educate, and create some sort of brand loyalty as well.
Kerry, you said two things that I thought were extremely powerful. What did you learn from COVID as a pediatrician, as a CEO? Being calm. Because I think, people look to their physicians, they're hoping you have all the answers, normally. And in a pandemic, you guys are learning too. So being calm, because I think it also helps leaders make better decisions when you're calm. So I thought that was very powerful. And then just being okay with not having all the answers. Because I think that the level of pressure on CEOs in all industries was insane. And I think a lot of us took that on our shoulders, thinking that we had to have all the answers when that's not realistic. Yeah, those are two powerful lessons for sharing. Thank you. Let me ask, it's a little bit off topic, but so the vaccines are out there. You're encouraging people to get them. I know we had a little something with Johnson & Johnson that they pulled. Any advice, any encouragement for listeners, for the public in general?
The vaccines are safe and effective, and we all need to get them.
Bottom line.
Bottom line.
There you go.
And if you're not getting them for yourself, then get them for grandma or my patient with leukemia. Get them for every child with a mental health issue and ADHD who really can't learn properly through remote learning. Step outside of yourself and do the right thing from a public health measure, which is to get vaccinated so that we can get ahead of this. Right.
Well, I'm glad. It's important coming from somebody like you, so I appreciate you sharing that message. I really do.
It really, I'm sorry to.
No, go ahead. Go ahead.
Is safe, and all of my doctors have been vaccinated. My children have been vaccinated. My daughter was breastfeeding; she got vaccinated. There are lots of rumors out there about the vaccine, and like with any vaccine, and in pediatrics, we've been dealing with vaccine hesitancy for years. And, a lot of that stemmed from, questions about the measles vaccine, which have been proven totally false, been retracted. And yet, these vaccine anti-vax movement has just taken on a life of its own. And, I think they've looked at it, and so many of the online information can be, traced back to a few people who have, just made it their life's work. And, what do you do if you want to discourage somebody from getting the vaccine? Tell them that it's going to have some problem with them getting pregnant or having children.
Fear.
How do you disprove that?
Yeah.
And they're putting so much fear in, but, you can't have children if you're not here anymore. And, you can't have children if you have blood clots and, you end up with an issue with that. So my advice is really to get the vaccine.
And I really appreciate you sharing that, because it's something that, listen, we need to be reminded of, and the importance from somebody like yourself who can speak on it intelligently. This is the kind of show that I could go down a lot of different tangents with you. Unfortunately, we don't have enough time. I love your passion for what you're doing. I love the fact that as we're talking and I'm getting to know you, I get the sense that you're really trying to make a difference, in particular in the world of pediatricians and pediatric practices. So let's leave the listener. Let's going back to what you're advocating for in the big picture, the message. If you had to, wrap it up, advocating for physician-owned medical practices, pediatric practices, your specialty, of course. Why is it so important? Why is it something that's right for the patients first, obviously, and physicians?
Mostly I'm advocating for physicians to be in charge of healthcare. Even though healthcare is a large part of our economy and we spend a lot of money on it, ultimately it needs to be run by physicians, and it comes down to the relationship between you and your physician in the room together, one-on-one. And in order to preserve that, we need to keep physicians in charge.
Awesome. Wow, that's like a mic drop, as they say, Kerry. Very, 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 very well done. Very, very well done. And if anybody's confused, I know the colors of Allied are orange and gray, I think you said. Complete coincidence. I show up with my orange shirt, and we both have orange wristbands on our watches. It was subliminal. I'm getting behind the cause and the message. Dr. Kerry Fierstein, thank you so much. Obviously for the work that you and your peers and colleagues have done through COVID for countless people. I would have loved to have gotten on the topic of mental health on this. I know it's a very important one. We don't have enough time, unfortunately. But thank you so much, and I wish you and Allied and everybody there much success. Thanks again for being on board.
Thank you so much. It's been a pleasure.
My pleasure. And this is the Profit Express. Today's guest, Dr. Kerry Fierstein. Her show will be dropping next Wednesday, so make sure to listen and download. Follow us on Instagram at The Profit Express, on Facebook at The Profit Express page, of course, on Twitter at Profit_Express. Make sure to listen, make sure to download. It was an amazing conversation on the state of healthcare, in particular with primary care and pediatric practices and the importance of having physician-owned practices. So until next week, this is The Profit Express.